As healthcare moves away from traditional fee-for-service models, providers need a strategy to stay competitive. That's where Strategic Healthcare Partners comes in. We offer expert consulting and ongoing management oversight for providers looking to form an accountable care organization. From financial feasibility analysis to helping you choose the right ACO in a crowded market, SHP provides the clarity you need to make informed decisions and transition to value-based care. Learn more at shpllc.com. Welcome to Beyond the Stethoscope, Vital Conversations with SHP. I'm your co-host, Jason Crosby, and I'm glad to say co-host to welcome back my partner in crime, Aaron Higgins. Aaron, how are you?
I am doing much better, Jason. I'm really excited to be back. I know from the audience's perspective, I haven't been gone that long, but for me, it feels like forever.
Fantastic. Well, welcome back. We're ready to talk about our second episode as part of the Banana series. What are your thoughts there?
Well, I've been very interested in this What If Your Healthcare Provider Went Bananas series. You and I sat at that game a few months ago now, and we started talking about this. You know, there's that if Disney ran your hospital, and there's been a lot of talk of how to compete in the healthcare market space. So I'm really excited on what you're going to be serving us up today. You know, of course, the Savannah Bananas are TikTok's favorite team, and they're all the rage on ESPN. So yeah, really excited to talk about how we can take their principles about fan first mentality and applying it into a practice or a hospital.
Fantastic. Yeah, we had a great time. Last week we introduced this concept to the audience, and as Aaron mentioned, today we're going to kind of dive into the patient engagement / fan engagement aspect of the Savannah Bananas and the healthcare setting. So with that, let's get on our banana suits or our yellow tuxes and let's jump right on in.
That's right. Or, you know, grab your favorite banana nana and settle in and listen to the episode.
That's right. So as Aaron mentioned, we went to a Savannah Bananas game a couple of months ago, and I'd like to think it was either the banana beer or the Savannah banana peel drink. Something got us to thinking, you know, we've been to a game, each of the last 6 or 7 years that they've been in existence, we've been to a game. And each time I've just found it very engaging. And I know you have as well, that you've seen the script before, but you have the same experience you did the very first time you saw it. And you and I were going back and forth as far as, wow, as fans, how do they have that mentality where we are just engaged from the moment we went on to buy our ticket, right? And we were excited even before we stepped into the facility.
Applying it to healthcare, of course, and someone who's been through a lot of healthcare recently is, you know, healthcare is kind of a boring topic, much like baseball had become in many people's minds a boring sport. And the Bananas turned that around.
They have. And, you know, to your point about healthcare and your experiences here recently, it made us think about, okay, we've all heard about the triple aim, the three pillars basically in our industry, right? Which under triple aim, one of those is about the patient experience, patient engagement. That's one of the triple aim that everybody in our industry has been, you know, has heard over and over the years. And from the Bananas perspective, it's fans first entertainment. It's the actual name of the company. It's their mentality. It's their mantra. It's how they basically engage with their fans. And I know you and I were going back and forth with, well, as a patient, when we make that first phone call to schedule our appointment, that's the equivalent of when you go to buy your ticket, right? And then when you go and you park and you walk in the waiting room, that's the equivalent of parking and walking up to the facility for the game. Even just those two pieces in comparison are drastic differences, right? You know, and you and I are talking about that in the healthcare arena, you go to a physician practice, kind of a cold, bland waiting room area. And then right off the bat, you're kind of in a negative sort of mindset versus when you and I walked up and we're engaged by, you know, a kid who's working in a banana suit and you're just instantly entertained And you're now thinking, wow, that's one way to engage patients right off the bat, isn't it?
Oh yeah, I know you're not saying, but I'm kind of imagining a big brass band in the middle of the cardiologist waiting room just to get people amped up and excited about visiting the cardiologist. I know that's not what you're saying, but maybe there's something to that.
There is. Right. And the perception of healthcare, we understand it. It's a thing of inconvenience. None of us want healthcare. We all need it. It's inconvenient. The relationships you have are distant. It's the insurance side of things we know from a consumer perspective. It's confusing as all get out. How can you translate that when you buy your ticket? You immediately know what you're getting. $25, I'm getting my food, I'm getting this. You feel connected by way of content when you're on their website. You know what you're getting into for the price you're getting, and you just feel a little bit more at ease. Whereas when you visit, the physician practice or the hospital, you fill out the same paperwork over and over. You're waiting in a quiet lobby, watching infomercials for a half hour. It's a cold disconnect, and you haven't seen the product yet, which is the physician. Whereas when you and I went to the Bananas game, we got there an hour and a half early. And I felt like we had been to a party and we hadn't seen the product yet, which was the first pitch. How do you take those things and make that waiting room into our very first episode was with Scott Regan, the Experience Economy, right? And he painted the picture of why do we have outdated magazines in the lobby? Why are the walls just bland and that sort of thing? Why aren't we engaging folks when you're sitting there for that 30 minutes in the waiting room? Versus you and I, we were having a good time eating food and talking, and we hadn't even started the game yet. How do we make that transition?
Well, I know that talking to Scott, he had talked about adding color and changing out those magazines more often and many of those other things. And I certainly invite our listeners to go back. You actually don't have to go back too far because we just reposted that episode a few weeks ago, and take a listen to some of Scott's ideas. It's not about necessarily the big brass band in the middle of the waiting room, or even serving up some banana beer, although I think that would make a PCP visit far more entertaining. But it is about how to set people at ease without making it too sterile. I know that that's what Jason's talking about here, because it's so easy to make things sterile. You have people who are potentially in a bad situation in terms of their health, but that doesn't mean their experience has to be bland, right, Jason?
Yeah, no, great point. It can be simple in manner, right? You buy your ticket, it's a simple website, click, boom, you park, you got to walk a mile. All they did to get you and I engaged is a 20-year-old kid in a banana suit. And then all of a sudden you've got the college baseball player standing outside high-fiving folks. That's easy. You've got, like you mentioned before, you've got a little band playing outside. But with all that loud music and entertainment, it was very simple and probably low cost for them to do that. And so we walked into the stadium already positive. Whereas when you walk and you're sitting in the waiting room, you started off a negative mindset, which is harder to recover back to the triple aim where you need 90+% sort of patient satisfaction survey results. It's harder to get it to 90 when you start me out at 30 than it is to start me out at 90 and maintain the 90% satisfaction, right? And so you and I were happy and everything else just walking in. I guarantee we're not like that when we go see our physician, are we?
Oh yeah, no doubt, because I don't know what my bill's going to be. I don't know how much towards my deductible is this going to count, or does it count at all? And there's all those other unanswered questions ahead of time, and I haven't even seen the clinician yet. And if I do get more than 5 minutes, I'm kind of lucky. So yeah, I know that patient satisfaction is certainly tied to better patient outcomes too. So I think that's another mindset that we need to get in, is that a happy patient is a healthier patient.
That's true. Great point. That's in addition to the loyalty aspect, right? You have a good time going to the Bananas game. You're going to pay more for that experience. Whereas if you're not having a good time going to see a provider, you're going to switch providers, which I've done. And I'm sure many of folks listening have, because we weren't simply engaged. And yet on the banana side, Savannah Banana side, we're engaged, showing up 90 minutes before our appointment. Think about that. The appointment is the first pitch at 7 o'clock. You're told to get there when the gates open at 5:30. If we had to do that with our physician practice appointments, if they said get there an hour and a half early and you're sitting in the lobby twiddling your thumbs.
I don't know. Some of my patient experiences have been just that. I show up at the appointment time and I have to wait 90 minutes before I'm even seen.
That's right. Don't show up at first pitch. That's right. You've already missed the action. Yeah. No, it's and what we found, and I know we're going to wrap up here in a minute, but one thing Aaron and I talked about as we showed up to the game was how engaged the staff was. To get a 20-year-old kid, and as a parent of a 20-year-old kid, I can definitely vouch for this, to have them willing to get in a banana suit and for a couple of hours engage folks walking a mile from their car, that's pretty darn impressive. And to get the staff game in, game out, every game, they're going by the same script almost. To have them engaged every game, to be happy, interactive with fans, there's a secret sauce there, but it's not just simply doing things or putting magazines out in your lobby. You've got to get the staff engaged to furthermore get the patient engaged. And I know we're going to get into that on our next episode, but there's some secret there as well that I know Scott Regan mentioned during his podcast of you just don't put something out there. You've got to get the staff involved with whatever it is you're putting out there as a product.
Well, positive attitudes are certainly infectious. And yes, there is a pun there since we're talking about medicine. But yeah, it definitely begins with a staff. And as someone who's gone to a Bananas game and experienced that 20-year-old kid in the banana suit, their excitement about us simply being there is contagious. You get there and you're excited to see them too. You're giving them a high five and you're listening to the music. What if healthcare was similar to that? I certainly would be happier about going to see my PCP.
You would. Well, it's the whole experience. You and I have compared. For those that aren't familiar with the Savannah Bananas, Jesse Cole, the owner, invented what's called Banana Ball. And it's a set of 10 rules, and we won't bore you with all those 10 of those rules, but there's a comparison to the Harlem Globetrotters that you hear about. They play what's called the party animals. Okay. I'm actually going to go see them tomorrow night. In fact, I know the script. But you're not going just for the game. You're not going just for the food, the entertainment. You're going for the full package. It's a show that includes a 2-hour game with an hour and a half pre-game, but you're going for the whole thing. Same thing with healthcare. We've talked about this. Yeah, you're going to get the diagnosis, talk about your symptoms with your physician for the 3 minutes you got them. But if you can make the whole experience part of why I come to your setting, you're going to have a more engaged, to your point, Aaron, healthier, and also a loyal patient. If you make that upfront when I walk through the doors, don't make me fill out the same paperwork 3 times. Give me some heads up on, patient estimation of my bill and that sort of thing. Give me the complete experience, and I won't be so, worried about the end product of the time with my physician. Well, I know we've talked through all the different 3 pillars of the triple aim, or we've introduced it. Aaron, any wrapping up thoughts on the patient engagement side of Savannah Banana Ball?
I think it will be a challenge for a practice manager or maybe a hospital leader to think outside the box, and that's okay. I also want to make sure you don't get discouraged. You may try something and it's not going to work right. And Jesse Cole tried many different things. And in fact, not every night is the same, because sometimes a gag doesn't work or the audience doesn't feel engaged over something. So just because you try and fail doesn't mean you shouldn't try at all, or that you should stop trying either. So that's another takeaway is try. As long as you're not causing harm, try something. If it doesn't work, then go back and retool it.
That's a great point. And you're right. For those that, if you're online, especially on LinkedIn, Jesse Cole's very active and has lots of posts. And of course, he's got a book coming out here again soon, I think this week or so, where he talks about his different journals of ideas and how they fail and learn from those. That's a great point for everybody to learn from. I know we've wrapped up the patient engagement side. I think next week we're looking at what we're calling the Triple A meets the breakdancing first baseman. That's right. Those that aren't familiar with the Savannah Bananas, a dancing first baseman. And we're going to get a little bit into Aaron on the staffing side and how staffing plus fans, as we just talked about, gets into the quality pillar of the AAA.
Oh man, I'm looking forward to it. Okay, Jason. Well, thank you all for listening, and thanks to Jason for putting all this together. And we'll talk to you next week at our next episode.
All right. Good to have you back, Aaron.
Good to be back. Bye-bye, y'all. You've been listening to Beyond the Stethoscope, Vital Conversations with SHP, a production of Strategic Healthcare Partners.
For more information about our podcast, including back episodes, show notes, transcripts, and more, visit our website at shpllc.com/podcasts.
And I know you've heard it before, but please consider rating our podcast in your favorite podcast app. It helps make others aware of the show.
And our podcast wouldn't be possible without our wonderful team of folks.
Editing and production assistance by Nyla, Wiebe, and myself, Aaron Higgins.
And your episode hosts are Aaron Higgins and myself, Jason Crosby.
Our social media coordinator is Jeremy Miller.
Our executive producers are also our principals, Mike Scribner and John Crew.
For more from SHP, consider following us on social media, including Facebook, Twitter, and LinkedIn.
And as always, thank you for listening and have a great, wonderful day.
You already know that understanding your data is key to improving patient outcomes and financial performance. But how? At Strategic Healthcare Partners, our analytics services help turn your EMR and other data sources into actionable insights. From identifying areas for improvement to guiding you through implementing changes, SHP supports you every step of the way. Our performance analytics service dives even deeper, providing custom reports that help you stay ahead in the transition to value-based care. Unlock your data's full potential with SHP. Learn more at shpllc.com.